Good afternoon, Senator Craven, Representative Farnsworth, and fellow members of the Health and Human Services Committee, and Senator Lachowicz, representing Senate District 25, which includes the towns of Waterville, Winslow, Albion, Benson, Clinton, Pittsfield, Detroit, and Unity Township. And those of you that have been here before know I just slowed that remarkably down. I want to thank you for the opportunity to speak before you and ask for your support of LD 1636, an act to provide for a more efficient and reliable system of non-emergency transportation for MaineCare members. In addition to being a senator, I'm also a licensed clinical social worker. In my work for the past 2 decades, I've had an up-close and personal view of how transportation to medical appointments is provided to MaineCare members. I've sat with children and families as they're waiting for their ride to pick them up. I've helped clients arrange transportation for themselves or for family members. In a rural state such as ours, this isn't always an easy task for the client, transportation provider, or the medical provider. When I looked into the changes and how we were going to provide transportation for MaineCare members, I became concerned. So many people in our communities worked hard every day to make that system work. What would happen when it changed? I've heard a lot of talk that you have to let a new system work out the bugs, and I suppose that's true. I've worked in healthcare long enough to see new models and systems come and go. Some have worked, some have not. But here's the thing. Providing transportation for people to medical appointments is a big deal. Sometimes it is for scheduled vaccinations or for possible ear infections, things that can likely be rescheduled fairly easily with little repercussions. But sometimes it's for chemotherapy for a cancer patient, or dialysis, or critical testing procedures for people with heart disease. Sometimes that appointment is for someone who is close to a psychiatric crisis. Other times it's simply for people to get to their jobs so they can pay for their bills. That's why this is a big deal. We can look at the human and the monetary cost, but either way I think the cost of our current system that began in August is not working, and the cost is too high.
Can you see it?
Too high for the patients, too high for the taxpayers. I ask of you, if it was you or your loved one that missed an appointment for life-saving chemotherapy for cancer, chemotherapy that is specifically scheduled to best beat back that cancer so you can survive, would waiting to let the bugs be worked out be good enough for you? What if it was your child who's having more meltdowns and becoming more dangerous to himself and his family, and you couldn't get in to see the psychiatrist for another 3 to 4 weeks after your ride didn't show up? Would that be acceptable to you? Or what if it was your elderly mother who had recently broken a bone in a fall and was in pain? How would you feel about a system that failed to get her to her doctor? I could spend the next hour or few or so telling this committee the stories I've heard from people who have been harmed by this flawed new system, but I know there are plenty of people here to do just that today. I and others on this committee have also heard many of these stories in our monthly meetings we held in between legislative sessions. In August of last year, when the new system for MaineCare transportation first went live, we all began to hear the stories of the missed rides, unanswered calls for rides, and more. Like many of you, I received numerous calls from constituents about the problem. To be honest, I couldn't keep up with it. Many patients reported having missed appointments because rides were delayed or failed to show up completely. The bottom line is that we have given the new system a chance to work, and it is not working. Taxpayers of Maine are paying $28 million for services that are not being delivered. At a time of scarce resources, we cannot afford to be paying for something we're not getting. This problem needs to be addressed immediately. We had a system that worked well for a rural state with an older population than many other states.
Yep.
Yes, the federal government had wanted our state to make some changes, but we had other options. I think the broker system would work well in a more urban state with many competing transportation providers. But that's not what we have. We never had a system like that. We're rural, our population is spread out.
Okay.
We never had multiple transportation providers competing for the privilege to transport patients to their appointments. We had a system where different regions had different transportation providers that had built up a network that worked well for the unique characteristics of that region. Some depended more on volunteer drivers than others. It's quite different to drive someone from Ashland to Bangor than it is to drive someone from Westbrook to Portland. I thought we needed a system that worked for us and would meet the federal requirements. So I started looking into this. I talked with MaineCare members, transportation providers, medical and behavioral health providers. I also looked in to see what other states had done. Maine wasn't unique in having to make these changes. By talking with legislators and administrators in Vermont, I discovered that they had considered making the same change we had when faced with the same dilemma. I asked questions. I discovered that Vermont is similar in many ways, rural, spread out, older population, but certainly not as big as Maine. But that state had decided that the brokerage system would not work as well in their state, so they crafted something different that met their needs and met federal guidelines. LD 1636 will create a more reliable and efficient system based on the Vermont model. Vermont satisfied the federal requirements but maintained a system that relies on local nonprofits arranging and delivering rides, similar to our system before the August 1st change. This bill would require the Department of Health and Human Services to contract with transportation providers in each region to provide transportation for MaineCare members. The department would negotiate on a per member, per month basis. It would not be the old fee-for-service model. Transportation providers and the Department of Health and Human Services would have to work together to consider the amount of MaineCare members in a region, fuel costs, logistics of travel in a particular region, and other factors. Transportation providers would have to develop the systems required to meet reporting requirements. The department would set performance standards, much like they do now. In closing, I ask you to give this bill your full consideration. I believe that MaineCare members and the taxpayers of Maine deserve something better than what we are getting now. We can build on what we have, make it meet our needs as a rural state, and meet federal guidelines, and keep more of our tax dollars in our own state. Thank you very much.
Thank you.